Assalamu alaikum. I am Professor Dr. Muhammad Ali Tirmizey. I have been examiner and convener for both FCPS and MCPS examination for the last 25 years. Today I am going to instruct you about the preparation of instrument bag for the postgraduate examination. Dr. Jamila, who is my daughter and who is the first female FCPS ENT surgeon in Faisalabad, they will then demonstrate her preparation of her own bag for the examination. The instrument bag is essential for the examination because the instrument provided by the institution may lack something and you are supposed to have your own, so you may miss that. And secondly, you are always comfortable while using your own instruments, just like a batsman is comfortable while using his own bat. You have to prepare your bag in such a manner that the instruments must be readily available and properly secured in place in the instrument bag. The instruments may not juggle up while traveling, and when you open the bag, then you can find anything whatever you want, and this must not confuse you, and it will spare your precious time during the examination. Let's discuss the instruments required for the examination. The instrument required for nose examination are gloves, sanitizer, transparent scales for nose measurements and exophthalmos measurement, bottle for smell test, cotton for patency test, thudicum speculum for at least 3 different sizes, probe must be multiple, posterior rhinoscopy mirror of 3 different sizes, and lighter for heating, and tongue depressor for sublabial area checking and for use during posterior rhinoscopy, and stethoscope for chest auscultation. If you want to use Killian nasal speculum instead of thudicum nasal speculum, then it is always allowed during the examination. Throat instrument. A tongue depressor, wooden and metal, at least 10 wooden tongue depressors with centimeter marking to measure intramural growths, probe to check gag reflex, ray band to hold tongue in indirect laryngoscopy, ideal mirror of at least 3 different sizes, and gloves for bimanual palpation. Instrument required for the ear speculum at least of 5 different sizes, otoscope, probes, Siegel speculum if available, but usually it is not required. If available, then it's good. Watch for hearing tests. Tuning fork with stand 512 necessary, 256 may or may not be required. 2 separate bottle with sweet, imposed mineral water with sugar and salt and dropper. Regarding the lymph node and neck examination, you require inches tape. Dr. Jamila says that she cuts it into half, and then first half with initial measurements is kept so that a long tape may not be difficult to use, and also a vernier caliper for measurement, but that's optional. If that is available, then that's very good. Torch and X-ray rolled out for trans-illumination test. Cranial nerve examination needs following instrument. For first cranial nerve, you need smell test, which has already been mentioned. For second, third, fourth and sixth cranial nerve, you need newspaper clipping for reading. Dr. Jamila printed out visual test in English and Urdu for reading. 3 colored pencils or chart paper strips. For fifth cranial nerve, you need toothpick for touch sensation on face, cotton for blink reflex, and clean probe of toothpick for touch sensation on tongue. For 7th, you need for Schirmer test paper, test for cauda tympani. For 8th nerve, you need tuning fork, which is already available, and watch. For 9th and 10th, you need indirect laryngoscopy mirror and probe for gag reflex. For 11th and 12th cranial nerve, you don't need any other instrument. The instruments for general physical examination are watch for pulse rate, thermometer, BP apparatus, and hammer for reflexes. Miscellaneous instruments which are also needed. One is stopwatch. That is essential because while you are examining a patient, you do not estimate the time. Then the time is finished and your examination is left. So you have to have a stopwatch and you continuously see that how much time is left. Kidney tray for used instrument, alcohol swab, and forceps must be available. Sometimes while probing you leave cotton behind, and it is very bad impression on the examiner if you leave something inside the nose or throat of a patient. So you have to have a forceps to remove that forgotten or left by mistake any piece of wood. Now I request Dr. Sayyida Jamila Ali Tirmizey to explain to you how she prepared her instrument bag for the examination.
Assalamu alaikum. I am Dr. Jamila and today we will talk about the examination bag and how I prepared it for my exam. But before talking about the bag, I want to talk about the other things that you need. Your headlight. You need at least 2 headlights which have been charged overnight. It gives a very bad impression that your light is out of charge and it's not working. That's why you should have 2 lights with you. One should be in your car. So in case before going to exam and you check and it's not working, you can run to your car and change it for the one that's working. Then you should have an overall. It doesn't even give you a professional look, but it also provides you with different pockets so you can put your things in it. For example, I used to put my BP apparatus, which was small manual BP apparatus, and my Welch-Allen's otoscope in that, so that you don't need another space in your bag. And I used to put this, I had Littmann cardiac 3-step, or you can use the classic step, and used to have it around my neck. Again, that will save you time and you will have it in your hand whenever you need it. So let's talk about the bag. First of all, I had a briefcase with me, and as you can see inside, I bought this sheet from the carpenters, or you can get it from a carpet shop. Now why was it necessary? I cut out the shape of each instrument so that, for example, this, and there is this shape inside, there is this indentation, so the instruments will not move when I close the bag. As you can see, all of these instruments are present within an indentation and they have their typical places where they are put. So we will start with the ear instruments and nose and throat instruments. So I had ear speculum, you can see over here, and it is at least of 7 different shapes and sizes. And why do I need so many? First of all, I don't know the kind of patient that will come. It may be a patient with narrow ear, it may be a patient with wide ear. Secondly, even if you don't have a case of ear and it's a case of nasopharyngeal mass, again you have to examine the ear. Or if you drop an instrument by mistake, you cannot pick it up and use it. You need to dispose it off and use a new one, because sanitation is very important in the exam. In the same way, I have different types of Thudicum nasal speculum and Killian nasal speculum. I don't think the examiner would mind if you use this instead of the Thudicum, but whatever you're comfortable with, try to use that, because if you are uncomfortable and not confident, the examiner will see that and it will go a long way. Then I have prepared probes. You can see the probe test, and the probes are already prepared with cotton on it, so you will not waste time making your own. Then I have this small light. It will be used along with this for transillumination test, and you can also use it for testing the light reflection. Then again, like Sir Tirmidhi have already told you, this is my measuring tape. I don't need 30 centimeter worth of measuring tape, this one is enough. So I cut the first half so I don't have to handle a lot of measuring tape. Now speaking of measuring, I have these are see-through scales. You can use it for intercanthal distance, for interpupillary distance, and for exophthalmos. Other than that, I also had a vernier caliper for the same purpose, but if you it's optional and you should learn how to use it before taking it. But if you have it, it will give a very good impression. Then when we are talking about measuring, I also had at least 10 of these wooden tongue depressors with numbers written on it, because if you have a mass inside the oral cavity or inside the buccal region, you cannot use a measuring tape. You can use this to measure it within any cavity. And because you don't know the same short case and long case you will have, you should have extras. Then I have this for light reflex. These color pencils, you can ask the patient to cover one eye and ask him what color is this and what color is this. And for visual acuity, I also had this. You can print it off from Google. I printed it out and got it laminated for Urdu and for English. You can ask the patient to cover one eye and then ask him to read it. If he is not literate enough for this, you can ask him to do that. And if he doesn't even know how to read these, then you can always tell the examiner the patient is illiterate and he doesn't know how to read, so I cannot examine the visual acuity of this particular patient. And if you want to be really on your A game, you can also print out things like that in which there are only pictures and ask the patient to identify those pictures only. But that's very rare. Then we have different sizes of tongue depressors. I had multiple wooden and multiple metal tongue depressors with me. I had different bottles. This is Jamishiri. You can use that for sweet, and I also had salty water in these bottles. Make sure they are very fresh. And then I had separate droppers for sweet test and for salt test, because you don't want to mix them up. Then I have this is for smell test. Ask the patient to close his eyes and then use it on one nostril at a time. Do not use spirit or alcohol swab for smell test. First of all, it's very pungent to the patient. Secondly, even if the patient's olfaction is not working, it will activate the trigeminal nerve and he will give false positive results. Then I had a kidney tray. This is purely for the used and the dirty instruments, so that the dirty and the new instruments don't mix. Then I use these for ideal. You can use Ray-Ban gauze. I also had Ray-Ban gauze with me. And I also had a scissor if I need to adjust the size according to the patient. Then I had these for touch sensation and for blink reflex. These cotton bud and these toothpicks. Again, as sir have already told you, you need forceps with you in case you accidentally leave behind any residue. Alright. Then sometimes patient that is presented to you and they say that the patient is a case of rhinoplasty. So in that rare occasion, which is very rare, I also have these. So I can measure the angle of this and the nose angle and the rotation and the projection. I have this and scales and vernier caliper for any case, in case I get a rhinoplasty patient. Then obviously you have the thermometer and you have the BP apparatus and you have other things. Then I have the ideal mirror. Ideally you should have the largest one, but you should also have the smaller sizes in case the patient gags, because if the patient gags and you weren't able to find the finding, you may not pass that examination. Again, I also have posterior rhinoscopy mirror as well of different sizes according to the patient. Now this thing I want to show you, I also have a watch and it is taped to the inside of my briefcase. So when I have started my short case on my long case, I know how much time is left behind and I don't have to keep looking at my watch during all of it, and my attention is totally towards the patient. And I have already told you about the transillumination test, and again you need at least 3 or 4 pairs of gloves because you might need it for bimanual palpation, any intraoral thing you need it for, or you have a parotid swelling and you need to do bloatment test. For that you need these, and it's a very bad impression on the examiner if you do the bimanual palpation using your bare hands. And while talking about the general physical examination, you also need a hammer. Now I used the pediatric hammer because it is easier to carry, it is smaller. You can get one of these from any medical store or you can order it online. I found one in Daraz for 600 rupees I guess. So this one is for pediatric, but it works fine on adult patient as well, and then I can use it. Some examiners appreciate it more if you have a rubber pad for your tuning fork test, so it will be best if you have that. And usually this tuning fork is more appreciated than the other one because it has a stand over there and it gives a better Weber's test and a better ABC test. So if you can find that, it's much better, but any other good tuning fork will do as well. So I guess that's it, and I hope you guys do really well in your exam, and best of luck from my side.